An Erris-based TD is calling on the HSE to recommence admitting patients to Belmullet District Hospital without delay. Mayo Deputy Rose Conway-Walsh has made the call after it emerged that the North Mayo Hospital is no longer admitting patients. The Sinn Féin TD claims that minor maintenance works was the stated reason from the HSE as to why there are currently only 5 patients at the district hospital. Deputy Conway-Walsh says it's vital that step-down patients from Mayo University Hospital and respite care returns to the Belmullet Hospital. She told Midwest Radio's John Morley that any centralisation of hospital services away from Belmullet will not be accepted by the local community.
I mean, we're in a situation now where there are 5 patients in Belmullet Hospital and a full complement of staff. And it's an absolutely ridiculous situation. Now, I understand in terms of the national protocols and all of that, and nobody's asking anybody to break that. But at the moment, Belmullet Hospital should be able to take at least the step-down patients from Mayo University Hospital. But Mayo University Hospital are being instructed not to send patients to Belmullet Hospital. And the reasons for this is that there are some maintenance works to be done. Now, I'm not talking about major maintenance. I'm talking about things like sinks and bathrooms and just some things that need to be done in terms of infection prevention. And this has been going on for weeks and weeks. It's probably 6 weeks ago since I contacted the HSE around this issue, and nothing has happened.
And how long is it expected that these maintenance works will take, and will that be the time frame we'll see before patients return to Belmullet Hospital?
Well, they cannot give me any answer when it'll be done. It's passed from estate to maintenance. We have an absolutely ridiculous situation where the maintenance for Belmullet Hospital comes under Mayo University Hospital. I have no idea why that is. But that certainly shouldn't be the case. Then you have estates who are responsible for the hospital in itself. I mean, as I said when I was talking to the HSE last week, if you landed from Mars and somebody told you what the setup is in relation to maintenance and estates and how the HSE does its business, they would think you are absolutely bonkers. This situation has to be sorted. The buck has been passed from one to the other. There's a EHO notice in respect of the kitchen that needs to be sorted. But these are minor things. Now, John, we see this morning where the Belmullet electoral area has the highest number of COVID cases. There is every possibility that there will be a spike in the future. We need Belmullet Hospital to be brought up to standard. We know there's a bigger plan there, and we need a bigger plan to sort out the hospital and to have the full complement of beds and services there. There needs to be capital allocation for that. But in the meantime, there's these works that need to be done, and the HSE need to sort them. Now, I shouldn't have to go to the Minister to sort these, but I'm going to have to go to the Minister to sort it when it cannot be sorted out regionally, because it's not only the step-down situation, John. We have a very high number of carers here in Erris and indeed throughout the county. They haven't had a break at all. Some of these carers are elderly people who have been looking after patients with very high medical needs within their homes. They cannot end their shift. They cannot say, I'm going home at 8 o'clock. There's nobody clapping for them. There's nobody doing anything for them. And they need to have a bit of respite as well. The only way that they can have respite when the national guidelines are lifted is if you have the facilities there within the community. We need the facilities. We need a step down, and we need the respite within the hospital as well immediately. So I am calling on the HSE and I'm calling on the government to sort this out as a matter of urgency.
It may also be needed in terms of capacity if we have a second wave coming and the private hospitals no longer under the HSE.
Of course it is. It's a ridiculous situation that they're not. Regardless of the private hospital situation, we have an area, the geographical size of Erris. The need is there. For years, the HSE have been trying to prove that the need isn't here and that the need isn't here within the community and they can centralise everything. They cannot do that. I don't want to bring the people of Erris out again to have to protest against attempts to close this hospital or to downgrade it. I just want them to fix it, and they need to do that. And it's more important now than ever with the COVID-19 situation, and as you said, the possibility of a spike again in the future.
Deputy Rose Conway-Walsh.